Hello, I'm Dr. Kyle Leggott and I'm a family physician. I love eConsults because they help me take better care of my patients and keep them within the primary care home when that's what's best for them. eConsults help my patients get the right care in the right setting in the best timeline possible. And in my practice as a family doc, there are quite a few times when I'm caring for patients that I just have a small question that's about something. And it's not huge, but it's sometimes outside of my scope or my comfort zone. And historically, I've had two options. Either refer patients to a specialty consult, which can typically take anywhere from 2 to 9 months or more to get in, or phone a specialist friend. We all know that we have them and we leverage that for patients from time to time when it's what's really needed, but that's not the right solution. It's not sustainable and we can't do it all the time. So I love that eConsults formalize a process for that phone a friend option, and they allow my patients to get recommendations from a specialist about their care, usually within 3 days instead of those 9 months. And those numbers speak for themselves. I've used them across many specialties in a lot of different ways, anywhere from asking a clinical pharmacist or a psychiatrist to help me on the next best step medication to try for a patient, to sharing a workup I've done and asking what are the next steps in evaluation, anything I'm missing, to figuring out if I can help monitor a patient's complex chronic illness in the primary care setting so that patient doesn't have to travel as far to see a specialist, to asking for help with putting a patient on a safe anti-epileptic regimen when that patient really needs to see the specialist, but they just can't or won't for whatever reason. One of my patients with epilepsy has a ton of social barriers and they won't see neurology despite all of my encouraging them to do so. But they will see me in the primary care clinic. And eConsults gave us the opportunity to get them started on the medications that they needed despite being unable to go see the neurologist. So sure, eConsults have some process elements that still need to get figured out, such as time to place them and time to respond to input. But I'm a big believer and that's going to come. And if you aren't using them, hopefully this will help convince you.